Meg, and welcome back. The Royal College of Midwives has warned today that thousands could leave the profession. It followed a survey of NHS staff which found a quarter were questioning their future after a full year of fighting COVID. Stress, exhaustion and a lack of support were some of the main reasons, along with concerns over pay. Here's our health editor, Emily Morgan.
I don't see me working in the NHS until I retire, and that's really sad.
They'd come in on their day off, they would stay late. You know, they gave everything to getting us through.
I've had to take a break because things go a little bit too much and I need to breathe.
It may be just a snapshot of how healthcare workers are feeling, but it may also be a reality the NHS is now facing. I met nurse Ronke last year, who was working on the front line. Shortly afterwards, she quit after it got too much and isn't alone. New research reveals a staggering 25% of healthcare workers, equivalent to 330,000 staff, say they're more likely to leave the NHS because of unprecedented pressure. That includes the equivalent of 100,000 nurses and 8,000 midwives.
If I had carried on, I don't know what I would have done, but definitely I was breaking down. I could identify that. How bad it would get, I wouldn't know if I hadn't stopped. But I reckon it would have been probably catastrophic. So, yeah, that's out.
You made the only decision you felt like you could?
Yes.
Rosie hasn't reached that point yet, but chronic understaffing where she works as a trainee healthcare assistant leaves her unable to cope. Just under half of those asked in the survey worked a shift with too few staff at least once a week, even during COVID.
I felt like I had more patients than I could care for properly, or care for, and ward staffing that we knew was unsafe and that we would vocalise was unsafe and that would be accepted as unsafe. It's hard not to get hopeful that it might change, but it's difficult to believe that it will change.
Matron Lucy's determined to help her staff in intensive care. The report found 2/3 of workers were mentally exhausted on a weekly basis or more, and a quarter said they drink or use drugs at least once a week to deal with stress.
The staff, at least once a day, are coming and talking to me how they feel, and that's really difficult. And what they're experiencing is, you know, it's symptoms of PTSD. They talk about they can't sleep, they're having nightmares, because this is the time to get it right and catch the staff and not have those people just walking away.
That is what Ronke did, but the government says it hopes to avoid more like her leaving, with extra mental health support and many more staff.
So going into the pandemic, there were about 80,000 shortages across the NHS. So we were already in quite a severe state. We're now faced with a worsened crisis. 1 in 4 people in the NHS say they're more likely to leave because of the pandemic. That's a shocking number. And it means 2 things, really. The first is about retention and keeping staff. In reality, most of those 330,000 people who are thinking about leaving won't leave. But even if only a fraction do, that will severely compound existing workforce shortages. Junior doctors, junior nurses, for example, leaving the country to work elsewhere. That was a trend that was happening before the pandemic. We might well see that accelerated now. Additionally, the second set of alarm bells that goes off is that 1 in 4 people who work in the NHS are thinking about leaving. That shows how dissatisfied the NHS workforce is. That has serious consequences for patients. It determines how quickly waiting lists can be brought down. It determines the quality of care that's available. The government may be taking a risky bet, tolerating such high levels of dissatisfaction among the NHS workforce. But it really is a risky bet indeed, and one that might be felt by the 4 million people on NHS waiting lists today.